Hi, I'm Brian Lau, and I'd like to thank American Acupuncture Council for having me back. We're going to look at a club exercise today. It can be used for a patient exercise or maybe for your own practice, but particularly we're going to look at shoulder girdle mobilization and rib cage mobilization. So we're going to be working with the Jue Yin channels, the liver and pericardium channel. Why don't we start by just a quick review of those channels, particularly the sinew channels, and then we can look a little bit at the anatomy and apply that to the exercise. So I'm going to put the presentation up and we'll start looking at that information. So this will be, again, kind of a focus on the Jue Yin channels. So first of all, just a quick review of the primary channels. We have on the left, we have the liver channel. Liver channel starts at the interspace between the first and second metatarsal, comes up the medial leg and thigh. This isn't as much of what we're going to be looking at today. Comes up into the groin and circles the genitals. And then this part will be a little more important as it traverses up the abdomen. Um, we'll look at how it kind of follows the line of the external obliques to liver 13, the motor entry point for the external obliques. So it's a major innervation site for the external obliques. It encircles the stomach when it comes internal. We'll kind of glance at that real briefly. The rest of the external channel goes to liver 14, also in the external oblique muscle. And then the internal branch kind of connects in through the throat and the head, and we'll leave that for another time. Pericardium channel goes on the midline of the anterior part of the arm, kind of follows the median nerve, but then it comes up into the chest, also links to the side of the chest. I guess you could say to the breast for women, but I would really consider it more in the soft tissue like the serratus anterior. So with that in mind, let's go to the sinew channels. Sinew channels for the liver sinew channel really ends at the groin. But I extend it a little bit further. We'll see this kind of softer color one is really more of an internal portion that goes a little deep into the deeper musculature of the psoas, iliacus, and the quadratus lumborum. But then it also links with those external obliques, which is going to be a major component of rotation, which we're looking at today. And it connects then with the paired pericardium channel, serratus anterior, also the lower costal fibers of the pec major and down into the arm. But we'll notice as we look at a better anatomy picture that this serratus anterior branch is going to wrap around the back. This is a way that I extend it. And it'll connect in the back with the rhomboids. It creates a sling with the rhomboids in the serratus anterior. So let's look at that anatomy. First of all, on the far left, we have that liver sinew channel ending at the groin, but it's on that same myofascial plane as the iliacus and the psoas. Iliacus then connects with the quadratus lumborum. Quadratus lumborum takes us to the 12th rib. It's between the ilium and the 12th rib and links with the diaphragm. We'll see a lot of the movement we're doing today is going to move the lower rib cage and mobilize that area of the diaphragm and the liver, which sits right under the diaphragm. So we'll note that anatomy there internally. But on the outside, we have the serratus anterior from the pericardium channel, interdigitates with the external oblique and creates a sling that wraps from one side all the way to the groin of the other side. If we follow the pericardium channel around, the serratus anterior goes under the scapula, attaches to the medial border of the scapula, but really it links fascially seamlessly with the rhomboids. When we do dissection with the sports medicine acupuncture program, we look at this rhomboserratus sling, and sometimes you can take some time and actually tease those away from the bone and see that they're continuous sling of tissue. That'll link into the splenia cervicis and capitis on the other side, so the opposite side neck. So from one side of the neck, in this case, in the image, the left side, it'll wrap around the right rib cage, link with the liver channel, continue along the right torso to the left groin. So it creates a sling around the body, very similar for those who know anatomy trains to the spiral line that Tom Myers talks about in his book. If you're not familiar with that, I wouldn't worry too much about it. But it's a very similar anatomy to that, though I take it a little bit slight alteration of how he organizes it. But the important thing to note today is it's a spiral. It's a spiral that facilitates rotation And when we're working with patients who have rotation type postural issues or discrepancies from the left and right, these channels would be largely involved. The liver itself has a range of motion. It has a movement in the frontal plane, kind of follows, if it stabilizes along this ligament, it's called the triangular ligament, but if it stabilizes along a particular ligament that attaches to the diaphragm, the liver can kind of move up and down more on the right side. So it has a movement on the frontal plane, it has a movement in the transverse plane, and it has a movement in the sagittal plane. We'll look at those maybe. I'll demo those real quickly when we come out of the PowerPoint. So bottom line for now is if we're going to mobilize this lower rib cage, we're also going to be moving and massaging the liver and moving the diaphragm. So diaphragm movement, liver movement, I guess spleen movement on the opposite side, but the liver is our thought for the day. And then the pericardium. Pericardium has attachments to the sternum, to the ribs, to the spine in the back. So we're going to be moving the shoulder girdle. It's going to pull on the thoracic spine, move the thoracic spine. That'll have some massaging and mobilization for the pericardium organ. So let's look at that sort of on me. It's easier to see it on a person than it is on the slides, but at least you kind of have a view of the anatomy. So first of all, I have this club. I'm going to grab this in a second. I'm just going to put it down for now. The liver itself, when we're doing this movement, we want to be able to move that liver so it can move in the transverse plane, kind of wrapping around with the rib cage, wrapping around with the rib cage. So we'll notice that motion. We're not going to have as much of this frontal plane motion. That's not going to be as big of a part of the exercise I'm doing today, but we might have a little bit of that sagittal plane motion. But primarily, we're going to be looking at that transverse plane motion because as I swing the club, it's going to pull the rib cage open. There's also going to be a lot of movement in the shoulder girdle, thoracic spine, so that's going to be moving the pericardium. So that's it. We're going to use a club. It's a really good way to work with this rotation. We'll do a little bit of a progression. If you're doing this yourself, you can start off with the first easier version and then sort of progress up. If you're working with patients who have shoulder issues, you just have to know when to give them the next level. I'll give some thoughts on that. A couple thoughts on the clubs themselves. I do have some variation of clubs here. I have some solid metal ones, 15 pounds, 10 pounds, and 5 pounds. Even that little small one on the farthest away from me is a 5 pound, but it's solid metal. So it looks very similar to this plastic one with metal filling, which is 2 pounds. 2 pounds is probably a really good place to start. These clubs are top heavy purposely, so they can tip very easily. And if people aren't doing good motion, they can kind of wing their shoulder in a position that's not particularly helpful. I have a 3 pound for the day's demo. I usually use a 5 or a 10 pound for these swings, depending on what I'm trying to accomplish. But start light, find the pathway. You don't want to hurt yourself. So it's better to start light. It's a lot more. 3 pounds is a lot more than it seems when you're swinging that club around and throwing it. So if you have a good pathway, it's an efficient movement, but you don't want to start too high. All right, so first progression. First progression, we're not going to swing it overhead. We're just going to go forward, back, forward, back. I want you to notice the rib cage. As I swing back, it pulls the rib cage open. I want to let it pull the rib cage open. So a couple things first. If you're following along with this, I want to highlight something. Is when I swing back, I'm turning my palm out. So my hand, if it didn't have the club, would be facing out. I don't want to go back with my arm internally rotated. That's going to put my shoulder in not a good position. Particularly if I had shoulder problems, that would be very aggravating. So as it goes along the midline, I want to turn out. In, out, in, out. Let it pull the rib cage. Pelvis is stabilized. So I'm letting the movement move the shoulders and the rib cage, massaging the liver. So back and forth, comfortable, and just letting that movement mobilize the rib cage. If you're working with a patient with shoulder injury, maybe they do a smaller arc. You have to start small and then work towards that full range of motion. And one last hint before we look at the next portion is don't let the pelvis kind of drag along. I have to stabilize so that I can move rib cage and shoulder girdle. All right, next part. Overhead, I'm going to place it just on the spine. I'm going to let it touch my back for this first part. And I'm going to work with the shoulder mobility, shoulder girdle mobility. I want to let the club drop down like I'm trying to scratch my back low down. Lift the elbow and make an arc. Bring the elbow in. That pulls the shoulder blade around. Lift the elbow, drop the club. Bring the elbow back. Lift the elbow, drop the club. Bring the elbow forward. Lift the elbow, drop the club, elbow back. So this works on the flexibility of the shoulder joint and the shoulder girdle. Up, around. It's okay at this phase to help yourself. I can push up. Or the big range of motion issue people have is to pull the elbow in. Up, let the club drop, elbow out. Up, let the club drop, elbow in. I'm making an arc. Patients, or if you're new to this, sometimes when the elbow lifts, especially if the tricep flexibility isn't there, the club lifts. But I don't want to do that. I want to lift the elbow, drop the club. So again, you can help yourself with the other hand at this phase and just work, take your time to get that flexibility. Next part, I'm going to lift the club away from the back and do the same thing. But the club moves. So you notice the club points to my same shoulder corner. The club points to the opposite shoulder. Same shoulder, opposite shoulder. It's like it makes a pendulum type motion. It swings. Once that gets comfortable, final phase, throw the club. Swings down, throw. I'm using my rib cage, shoulder. Same thing, I don't want the pelvis to go too wild, so I'm stable, letting the rib cage move. Okay, that's forward throws for back. I want to come over the same shoulder. I have to turn my torso to the opposite side. Over the same shoulder, pendulum along the back, swing out. So open the rib cage. Open the chest, open the rib cage. All right, so we'll do that again on the other side, but I want to highlight a couple things just from working with people on this a lot. I give this to patients, maybe not the full movement or maybe portions of it, and I progress them through the whole thing. I also do it in a Zoom Qigong class. So I work with a lot of people that way. We do it in Tai Chi class sometimes, and we apply some Tai Chi drills to it. But working with a lot of people with this, there's some common mistakes. The first one is the club can get horizontal, and that kind of loses the trajectory. I don't do that. When the club swings back, it points back, up. And then it's like tucking an arrow into a quiver. It swings around in pendulums and out. And again, you see the club's up and forward. So I don't want to let the club get horizontal. I don't want that top heavy portion to throw me around and then I lose control. It's a very clean pathway. So point up, in, throw. Up, in, throw. Same thing as I go back. Club points up, in, throw. You can see there's a moment in time where my elbow's down, tip of the club is up, and then it comes through. All right, so we'll go through those progressions on the other side. So first one, I'm going to let the shoulder warm up and the rib cage start to mobilize. Palm turns in, palm turns out. In, out, rib cage moves. So maybe more of the spleen being massaged on me now, but it's still that region of the liver channel and the sinews of the liver channel. So rib cage mobilization, diaphragm mobilizes. When I'm ready for the next one, I'm going to take the club onto the back, elbow up, club drops down, elbow in, elbow up, club drops down, elbow out. I'm making an arc with my elbow. I can help myself if I want to work on the range of motion. Take the club away from the back, pendulum. So it points towards the side I'm holding the club on, points towards the corner of the opposite side and makes a pendulum. And then when I'm ready, I'm going to take that pendulum into a throw. In, throw. In, throw. Other direction, turn, throw. So let the whole torso open, pull back, chest opens, out, relax down. So it's a full core movement. Okay, forward again, throw. All right, so that gives the basics of it. I would start slow, start with getting control of the club and the swinging, start with the range of motion before you start worrying too much about throwing. But I do want to show it once from the back so you can see that pendulum. Because that pendulum is what makes the club a little bit more weightless. The idea is no matter how much weight you are, you're controlling the weight, but you're also using the momentum to throw. So let's look at that pendulum from the back. I'm going to turn around. So we'll go with the forward throws. I'll go kind of slow with this. So it tucks in. You can see that angle swings around and then through. Swings around through. So it's a pendulum type motion as I pull my elbow to the corner. Okay, when I go back, same thing. It's going to be in the opposite direction. Over the shoulder, pendulum around, throw. All right, so very nice. I think that'll give a good setup for it. I have a couple of videos on my YouTube channel that goes through it a little bit different, but same idea. That's Jingjian movement training. So if you want a little extra resources, but you can also watch this video. I would recommend maybe practicing along with the video a few times to get the angles. Again, start with a lower weight, 2 pounds, 1 pound if you have a history of shoulder problems, before going up to something like 5 pounds or even heavier once you get comfortable with it, 10 pounds. It can be a good way of doing strength training, but you don't want to injure your shoulder, so you want to start slow and get the pathway. Who would be benefiting from this? Obviously, people who want to increase the mobility of their shoulder girdle. So people who have shoulder problems, if they have a painful arc and it's extremely painful to get the shoulder up, well, maybe not quite appropriate for those patients. But they could start with using it to help swing and increase that range of motion at a lower capacity. And then as they get a little more comfortable, they can let that arc become a little bigger. But then I would definitely want to start with them once they're ready here, getting that range of motion a little higher, dropping the club a little bit more before they start throwing weight around, because it is more weight than you would think when it's away from the body. But also working with back pain, especially when there's thoracolumbar junction type pain that might radiate down to the sacroiliac joint or the hip. This motion of the torso and that flexibility of the rib cage and diaphragm can be very helpful for that. Internal problems, liver qi stagnation, or any TCM patterns that involve the liver, it would be a nice way to massage the liver and create a little more suppleness and circulation, increase that circulation around the diaphragm and liver region. So it doesn't have to be musculoskeletal problems. It could be digestive issues, a whole bunch of things where there's a component of liver disharmonies. So be creative with it. There's a lot of things you can do with it. It's an enjoyable exercise, and it's something patients can do on their own, or if it's something you're doing for yourself, it's something you can do on your own. All right, I think that'll wrap it up for today. So again, I would like to thank American Acupuncture Council. Maybe we'll do a follow-up to this and look at some Tai Chi drills with the club. It's a really great tool.